There is a new report out tonight that shows women in BC are among the healthiest across Canada, but the report from the provincial health officer says there is still room for improvement. HIV is down, but other sexually transmitted diseases are up. And even though BC women are living longer lives, many of them are doing so with chronic conditions from depression to diabetes. CTV's Erin Glazier has the story.
Women in BC come in every shape, size, ethnicity, and age. And a new study released today by the Ministry of Health says women here are among the healthiest in the country.
We looked at indicators of health status, living and working conditions, maternal and infant health, individual skills and choices, some aspects on the physical environment, chronic disease and injury, and health services.
The report also shows that BC's teen pregnancy rate has dropped by half. BC women also have more access to clinical services, increased income, hold positions of power, and are living longer than male counterparts.
I think we have the benefit of a really good climate, and people out here do seem to take better care of themselves, in my experience, having spent lots of time in meetings back east.
Yes, women like to think we live a healthier West Coast lifestyle compared to the rest of Canada. From getting regular exercise to eating well, young women are following suit.
Steamed beef. But in BC, there's just like a general overtone of like relaxation. There's yoga everywhere you go. There's, I don't know, and it's kind of cool to eat healthy.
But it's not all good news. Sexually transmitted diseases are on the rise in younger women, while the rate of chronic disease is increasing in aging generations.
Chlamydia is a very silent sexually transmitted disease. That's why women are often, when they come in for routine checkups, these are the sorts of tests that are done. The consequences are much further down the road, the scarring of the tubes between the ovaries and the uterus, so that people just can't conceive.
And when it comes to careers,
chronic diseases, women are now essentially toe-to-toe with men, competing for the same jobs, and as a consequence, everything from obesity, hypertension, basically heart attacks, all of those sorts of things, type 2 diabetes, that come with the sedentary, career-driven individuals.
If you don't make much money, you're also at risk. Women earning a lower income are living on average nearly 5 years less than affluent women. But overall, Stanwick says the study is encouraging.
It's that old idea that you got to take care of yourself as well as the important people around you.
And that means women in BC should keep striving towards good health. Erin Glazier, CTV News, Victoria.